obligate intracellular agents like chlamydia. Chlamydia is an obligate intracellular parasite which requires host cells to survive and replicate. It is a gram-negative bacteria and does not synthesize its own ATP, so it depends on host cell energy. For epidemiology, it is the most common sexually transmitted disease in the United States. In many cases, actually go untreated because patients can be asymptomatic. For clinical significance, this can lead to infertility if it's left untreated due to reproductive tract damage. For vertical transmission, some mothers can infect babies during childbirth. Some clinical manifestations in infants for chlamydia is infants that are infected during childbirth can develop eye infections or even serious pneumonia. Some species of chlamydia that we worry about are the three main species, so Chlamydia trachomatis, Chlamydia psittaci, and Chlamydia pneumoniae. The host specificity, so Chlamydia trachomatis and Chlamydia pneumoniae infect only humans, where Chlamydia psittaci primarily infects birds, and humans are actually an accidental host. For identification methods, the diagnosis is often based on detecting antibodies to antigens, and common techniques can include complement fixation tests and fluorescent antibody procedures. We can also do serologic tests like complement fixation tests, which are going to detect antibodies in patient serum against the chlamydia antigens, and it measures the ability of patient antibodies to fix complement in the presence of chlamydia antigens. This is useful for detecting recent or even past infections, but it does have some limitations due to cross-reactivity and lower sensitivity for acute infections. We can also do fluorescent antibody techniques, so it uses a fluorescently labeled antibody that binds specifically to chlamydia antigens. There are two different types, so we have a direct fluorescent antibody, which is a labeled antibody that binds directly to chlamydia antigens in the specimen, and then we have an indirect fluorescent antibody, and that's where the patient's serum is tested for antibodies that bind chlamydia antigens. Then a fluorescent anti-human antibody is applied. It offers rapid and specific detection, and it's commonly used in clinical labs for diagnosis. Some other identification techniques are the nucleic acid amplification test, or the NAATs. This is a highly sensitive and specific molecular test like PCR that can detect chlamydia DNA or RNA in clinical samples. Currently the preferred diagnostic method for Chlamydia trachomatis infections. For culture, this requires living host cells since chlamydia is an obligate intracellular pathogen, but these are labor-intensive and they are less commonly used. We can also do an antigen detection, so we can do an enzyme immunoassay or direct fluorescent antibody test that can detect chlamydia antigens in clinical specimens. So the life cycle of chlamydia, as we start with the elementary body, this is the infectious form of chlamydia. It is extracellular and metabolically inactive. It is responsible for attachment to and invasion of host cells. It is small and dense and adapted for survival outside of the host cell. Then we have the reticulate body. This is the non-infectious form. It is intracellular and metabolically active. It replicates inside host cells by binary fission, and it's larger and less dense than the elementary bodies. So the life cycle steps is it has attachment and entry. So the elementary body attaches to the surface of the host cell and induce uptake by the cell. For differentiation, once inside a membrane-bound vacuole called an inclusion, elementary bodies differentiate into reticulate bodies. For replication, the reticulate body multiply by binary fission within the inclusion. For redifferentiation, so after replication, reticulate bodies redifferentiate back into infectious elementary bodies. And then we have the release. So elementary bodies are released from the host cell, often by cell lysis or extrusion to infect neighboring cells. So in summary, the biphasic life cycle allows chlamydia to survive outside the host and proliferate inside host cells. This intracellular life cycle complicates treatment and diagnosis. Clinical significance for chlamydia, there are three different categories. So we have the classic trachoma. It's a chronic ocular infection. And then we have a sexually transmitted genital infection. Again, this is the major cause of pelvic inflammatory disease. And then we have the prenatal. So we can see infants that have conjunctival and respiratory infections that are acquired from their mom. Chlamydia psittaci causes psittiotosis. This typically is an infectious disease of birds, and humans can become infected by inhalation of the dried feces from the birds. Chlamydia pneumoniae is responsible for 20% of community-acquired pneumonias, and the specimen collected should contain host cell epithelial scrapings. The diagnosis in the laboratory can be by cytology or culture, but typically we're going to use some type of direct antigen detection of either the antigen or the nucleic acid in some type of serologic testing for confirmation. Specimen sources can be from the urethra, cervix, conjunctiva, nasopharyngeal, or the rectum. Make sure that you're using appropriate collection swabs and transport media if chlamydia is cultured and or transferred. You will need to use a specific cell line for recovery of that organism. So these are usually referred to as McCoy cells, and there is more information on McCoy cells in your textbook. With chlamydia, your treatment of choice is doxycycline, erythromycin for people, women who are pregnant and infants, and chlamydia acidiae treatment is lots of times going to be tetracycline.